My name is Lise Kasongo, and I work at Lowell General Hospital. I got my vaccine actually at Lowell Community Health Center. That's where I previously worked. And at first, I wasn't going to get the vaccine because, much like everyone, I was really skeptical and I didn't really know what was in it. And I wasn't trusting, much like everyone, and but eventually I decided to do my own research. I decided to join panels of doctors and nurses and scientists that spoke about the vaccine and spoke about what was in it and spoke about kind of the journey to creating it. And it kind of opened my eyes to realizing that I should get it and to realizing that this will be kind of the first step to stopping this pandemic. So I got my vaccine in January. That was my first dose. I got the Moderna. I got the vaccine in January. The second dose, I got it in February. So my experience with that, the first one was not very great, the first dose. They told me, the nurses told me exactly what I could expect potentially. They said some people feel nothing, some people feel all the symptoms. And I felt all the side effects. And during that time, I was kind of like worried, like, oh my gosh, why did I do this? But they went away after like 2 days. And the second time, I was better prepared mentally for the potential side effects that could come. And they weren't as bad as the first time, but I was able to get through it. After 2 days, they went away. So yeah, the main reason why I think I decided to get the vaccine is because I came to believe in the science. I came to believe in the healthcare professionals that, created it, the healthcare professionals that are also taking it themselves. And again, I think it's really important that everyone, I'm an advocate for the vaccine because I think that it's really important. As I said, it's the first step into ending this pandemic that we've been for about a year now. And I do understand and I do sympathize with people that do have kind of like a misconception, or they do have kind of they're kind of worried, maybe a mistrust for the vaccine, or the mistrust for the healthcare system in general. I know certain communities have gone through that kind of mistrust for kind of a long time, especially the Black community. So I do understand that. But I think it's important that maybe we talk to our primary care physicians and we ask them, hey, is this a good idea for me to take it? Do I have any underlying health conditions that can maybe potentially be that could potentially hurt me, or if I do take the vaccine, just to make sure that the vaccine is safe. And I think if your primary care physician says that it's safe, I think maybe we should take a step back and really think about, okay, maybe I should take this vaccine. And here I am now in March. I'm fine. There's nothing I haven't had any other symptoms since I've taken my second dose. I haven't had any other worries. It's kind of like a take it and kind of forget about it. And I feel a little more secure. And I feel that I want other people to feel that secure because we've all had a lot of anxiety this past year, a lot of fear. We haven't been able to leave our houses. So I want other people to feel that security. And that's also the main reason why I also work at the mass vaccination program clinic with Lowell General, is because I really want to be part of that environment of people just kind of getting their life back together, after the year that we've been. So yeah, that's kind of my experience with the vaccine.